My name is Roann. I'm a registered nurse with Vessel Health, and I'm here this morning talking with Sean Frazier. Sean,
yes.
So you're here. You are a patient at Vessel Health, is that correct?
Yes, ma'am.
Good. And you have been seeing us for varicose veins?
That's correct, yes.
How long have you had varicose veins?
I've had them for a while. I would say probably over 5 years, but they just seem to be getting gradually worse over time, and they were kind of affecting my mobility a little bit. I was feeling like a heaviness in my leg, especially my right leg, so that's why I came to see Dr. White.
Good. And what do you do for a living?
I'm a fireman.
Oh, so it's important for you to have legs that work well out there fighting fires.
And
Good.
also, I mean, cosmetically, I mean, it's really, they look bad. It's just, so between the two, I came and saw Dr. White.
Do you have a family history of varicose veins?
My mom, yes, she has them. And then I was
see.
also told that being Irish has something to do with it.
Is that right?
Yes, that's
Is
what
that right?
Dr. White told me.
So how many vein procedures have you had with Dr. White at Vessel Health?
I've had one. I've had a venous ablation, and I'm getting ready to have my second one.
And how did that first one go?
It went very well. It was much easier than I expected. There was very little downtime, you know, basically the afternoon after the procedure. And the next day I was up and about and back to work 3 days after that.
Excellent. And did you get relief from your symptoms?
Yes, absolutely.
Excellent.
Sure did.
Excellent. So you're back today for number 2.
Oh yeah, so much fun the first time. I'm ready to go again.
All right, great. Well, good luck, and I'll be talking to you after your procedure today.
Okay. Thank you.
Good morning, everybody. It's Dr. Harvey White with Vessel Health. Today we'd like to take you on a little tour of a procedure that we're going to perform in the domain of vein care. You met our patient Sean earlier, who has symptoms of venous reflux disease which have bothered both of his legs. And we have a treatment plan for him outlined. His right leg is the more symptomatic leg, and eventually we'll do 3 procedures on that leg. We've already performed an ablation that I'll explain in a moment. That's the procedure we'll do today on the left leg. In the future, we plan to do a second ablation on the right leg and a phlebectomy, and we hope to bring you back for the phlebectomy in the future. But today our focus with our ultrasonographer John, our assistant and our medical assistant Desiree, is to perform a radiofrequency ablation on the left leg. And we do this to improve symptomatology, that is, improve discomfort, varicose veins, inflammation, etc., in patients, in concert with documented incompetence of the valve in the leg that I've explained to you in another video. Radiofrequency procedure has several steps to it. The first step is to obtain access into what's called the left, in this case, greater saphenous vein. And to do that, we use a standard technique of putting a small needle in the vein, a gentle wire, and over that an intravenous catheter, and we'll show that momentarily. As mentioned, we perform this procedure with ultrasound guidance, and this is the head of the ultrasound probe. I've placed some anesthesia in the area where my finger is, and we will enter the vein with a small needle followed by a very soft wire, which you can see in my hand, and subsequently an intravenous catheter, which I'll display after we've introduced it. So this is the technique that's commonly used. We've completed our venotomy, that is access to the greater saphenous vein, and we can show you, as I point down to Sean's leg, the introducer catheter. John, our ultrasonographer, has made guiding marks along the greater saphenous vein that course through its trajectory up to the saphenofemoral junction. We'll be introducing this radiofrequency ablation catheter, shown over my hand, that has a segment which emits microwaves, and we'll explain how that works as the procedure proceeds. But what we'll do next is advance the ablation catheter through our sheath up to the saphenofemoral junction. I've pre-measured the catheter and put a mark on it where I believe it will need to go to reach our goal. We don't want to enter the deep system for fear of causing a blood clot or thrombus, and we'll be looking at that with ultrasound guidance. So I'll next introduce the ablation catheter. And we do this very gently, as there's occasionally branches that we need to traverse Now, there's our ultrasound catheter. The next step of our procedure is to provide adequate anesthesia. And we do that with what's called tumescence. Tumescence is simply a solution of saline or salt water, lidocaine or novocaine, as you might know it, and a touch of sodium bicarbonate. Essentially, we're going to surround the catheter that we've introduced in the greater saphenous vein with fluid, and that fluid provides insulation from the heat that we're going to be using, and also anesthesia. So I use a small needle, and what we'll do is, in stepwise fashion, where John has made his marks, put fluid around the catheter. On the ultrasound machine, you can see the image of tumescent fluid surrounding the compartment that the greater saphenous vein courses in. We've provided adequate anesthesia along the course of our catheter, and the catheter has a switch that is near my finger here. We've attached our catheter to the radiofrequency generator, which will be over my left shoulder, and during the procedure we'll show its function. So at this point in time, I am going to turn on the instrument, and we can watch, yes ma'am, the procedure. And what you can see on the left is we're providing about 120 degrees Celsius heat at a very low wattage, meaning that it's adequately anesthetized. And we'll do this in 2 cycles over the proximal greater saphenous vein, and then stepwise serially down the vein. So that was our first treatment, which Desiree is recording, I can tell. And we'll provide another treatment. These are 20-second treatments. Next, I'll bring the catheter back about 7 centimeters, or the length of its active tip. And we'll provide another treatment. This catheter is called a closure fast catheter. It's made by a company called Venus, V-N-U-S. And it's called closure fast because it enables us to do this quickly in 7-centimeter segments. We'll treat again. And once again, we've performed 9 treatments on Sean's greater saphenous vein. You can see on this catheter marks that mark the steps that we took in pulling the catheter back from the saphenofemoral junction to the completion of the procedure just below the knee. Now we've completed a radiofrequency ablation procedure, including the introduction of a catheter in the greater saphenous vein, the transit of the radiofrequency catheter to the saphenofemoral junction, the provision of tumescent anesthesia, and finally the treatment in 7-centimeter segments throughout the course of the greater saphenous vein. We've achieved hemostasis, and next we'll complete the procedure by wrapping Sean's leg in a compression dressing that includes 3 layers from foot to thigh. That particular dressing will remain intact for 2 days. We'll take it off, scan the leg for adequate treatment result or effect, and hence thereafter apply a thigh-high compression hose that he'll wear for about a month. In a few minutes, when we get this done, we'll have an opportunity to interview Sean to get his impressions on this procedure.
I'm back again with Sean Frazier. Sean, you just had a venous ablation for varicose veins with Dr. White. How did that go?
It was a piece of cake. It was very, very easy, very quick. It was faster this time too. It
Is
went
that
really well? Yes.
Great. So did you feel any discomfort or any pain during the procedure?
Just slight when I was getting the anesthesia, just like a little bee sting, and that's pretty much it. That's pretty much it.
Very good, and it seemed like it was a very short procedure.
It was.
It about 20 or 30 minutes or so?
Yeah, probably from start to finish, 30 minutes exactly.
So what are the next steps?
I believe I have to come back in 2 days for them to take off the compression dressing and scan my leg, and then a follow-up a month after that.
Dr. White is a terrific doctor. I'm sure you're going to have superb results. Thank you very much for allowing us to interview you and for allowing us to film your procedure.
No problem.
It's been a pleasure.
Thank you.